As we grow older, protecting the heart becomes more important than ever. The heart has carried us through decades of living through long workdays, stressful moments, joyful celebrations, and countless ordinary days that slowly shape a lifetime. By the time we reach our 60s and beyond, most of us become more aware of it than we were when we were younger. We start paying closer attention to blood pressure numbers, cholesterol levels, and the advice doctors give about diet and exercise. But what if one of the biggest threats to heart health isn't always the food we eat, the stress we carry, or even the genes we inherit? What if the danger is sitting quietly inside a small bottle in the medicine cabinet? This is something that surprises many people. After all, medications are meant to help us. They're prescribed by doctors, approved by health authorities, and used by millions of people every day. For many conditions, they are life-saving and essential. Yet the truth is that as the body ages, the way it responds to medications changes. A dose that once worked perfectly at age 40 or 50 may behave very differently at 70. Organs that process medications like the kidneys and liver gradually slow down, blood vessels stiffen, the heart itself becomes more sensitive to changes in fluid balance, electrolytes, and blood pressure. As a result, certain medications that are generally safe for younger adults can quietly create new risks for older ones. Cardiologists and geriatric specialists have been raising awareness about this issue for years. They've observed a pattern again and again. A patient comes in complaining of fatigue, dizziness, swelling, or shortness of breath. The symptoms seem vague at first, sometimes even dismissed as just part of getting older, but after reviewing the patient's medications, doctors often discover that one or more commonly used drugs may be contributing to the problem. The surprising part is that these medications are not rare or obscure. Many of them are extremely common. Some are sold over the counter. Others are prescribed routinely for pain, sleep problems, acid reflux, or blood pressure, and in many cases, people continue taking them for years without anyone pausing to reassess whether they're still necessary or whether the dosage remains appropriate for their aging body. That's why understanding medication risks becomes so important after 60. This isn't about fear or blaming medicine. Modern medicine has extended lives and improved quality of life in extraordinary ways. Instead, it's about awareness, knowing that even helpful treatments should occasionally be reviewed, adjusted, or replaced with safer alternatives when needed. In the following sections, we'll explore several types of medications that can quietly place extra strain on the heart or overall health in older adults. Some of these may already be familiar to you, others might come as a surprise, but each one has something in common when used without careful monitoring, especially in aging bodies. It can increase the risk of complications. Understanding these risks gives you power. It allows you to ask better questions, have more informed conversations with healthcare providers, and make choices that protect not only your heart but also your independence and overall well-being. We'll begin with a group of medications that many people take without thinking twice. They're found in nearly every home and are commonly used to relieve pain, reduce inflammation, and make everyday aches more manageable. Yet for older adults, these familiar pills can sometimes place unexpected stress on the heart and kidneys. Non-steroidal anti-inflammatory drugs commonly known as NSAIDs include medications like ibuprofen, naproxen, and diclofenac. For decades, they have been widely trusted as effective treatments for headaches, joint pain, muscle soreness, and arthritis. Their ability to reduce inflammation and relieve discomfort makes them incredibly appealing, especially for people dealing with chronic aches that often come with aging. For someone with arthritis in their knees or stiffness in their back, taking one of these pills can feel like a simple solution that restores comfort and mobility. Many people keep them within easy reach in kitchen cabinets, bathroom drawers, or bedside tables. But while NSAIDs are effective pain relievers, they also influence several important processes inside the body. One of their effects involves how the kidneys manage salt and water balance. In younger adults, the body usually adapts well to these changes. The kidneys adjust fluid levels efficiently, and the cardiovascular system compensates without much difficulty. However, the situation can change as people age, even in healthy individuals. Kidney function gradually declines over time. This decline often happens so slowly that routine blood tests may still appear normal, yet the kidneys may no longer process fluids and medications as efficiently as they once did. When NSAIDs interfere with kidney function in older adults, the body may begin retaining more salt and water than it should. This can lead to fluid buildup that quietly places additional strain on the heart. The first signs are often subtle. Shoes may feel tighter by the evening. Ankles might appear slightly swollen. Some people notice a heavy sensation in their legs or feel unusually tired after activities that used to feel easy. These changes are frequently attributed to normal aging, but sometimes they are early signals that fluid balance is shifting in ways that make the heart work harder. Fluid retention increases blood volume, which raises the pressure inside blood vessels. for individuals who already have high blood pressure or a history of heart disease. This added pressure can worsen existing problems. Research has shown that frequent or long-term use of NSAIDs can raise blood pressure and increase the risk of heart attacks, strokes, and heart failure in certain individuals. The risk is especially concerning when these medications are combined with other drugs that affect kidney function or blood pressure. For example, many older adults take medications like diuretics, often called water pills or ACE inhibitors, to control blood pressure. When NSAIDs are taken alongside these medications, the combined effect can sometimes reduce blood flow to the kidneys and disrupt the delicate balance that keeps fluid levels stable. Doctors sometimes refer to this combination as a triple risk for kidney stress because it places multiple pressures on the same organ system. What makes this situation challenging is that the symptoms often develop quietly. There is rarely an immediate warning sign. Instead, the body slowly adapts until fatigue, swelling, or changes in blood pressure become noticeable. For this reason, experts often recommend that older adults use NSAIDs cautiously. Occasional use for short periods may be appropriate for some individuals, but daily or long-term use should be carefully reviewed with a healthcare professional. In some cases, other approaches may provide relief with fewer risks. Certain types of pain respond well to acetaminophen when used within recommended limits. Topical anti-inflammatory creams or gels can also reduce joint pain without affecting the entire body the way oral medications do. Physical therapy, gentle stretching, heat therapy, and lifestyle adjustments can also play an important role in managing chronic discomfort. The goal is not to eliminate pain relief, but to ensure that the method used to relieve pain does not unintentionally create new health challenges. Moving from pain medications to another category, there is a group of drugs commonly prescribed for sleep problems and anxiety that deserves careful attention. Especially in older adults, sleep difficulties become more common with age. Many people find that they wake up more frequently during the night or struggle to fall asleep as easily as they once did. Anxiety may also become more noticeable during certain stages of life, particularly during periods of change, illness, or loss. In these situations, doctors sometimes prescribe medications from a class known as benzodiazepines. Examples include lorazepam, diazepam, and temazepam. These medications work by calming activity in the brain and nervous system. They can reduce anxiety, relax muscles, and help people fall asleep more quickly. For someone who has been struggling with sleepless nights or persistent worry, the effect can feel like a welcome relief. However, the same calming effect that helps induce sleep can also slow down important functions in the body. In older adults, benzodiazepines can reduce reaction time, impair balance, and cause lingering grogginess that extends into the next day. These changes may not seem dramatic at first, but they significantly increase the risk of falls. Falls are one of the leading causes of injury among older adults. A single fall can lead to fractures, hospitalization, and long recovery periods that affect independence and quality of life. In addition to fall risk, long-term use of benzodiazepines has been associated with memory problems and cognitive changes. Some individuals experience mental fog, difficulty concentrating, or increased forgetfulness. Over time, the body can also become dependent on these medications. As tolerance develops, the original dose may feel less effective, leading some people to increase the amount they take. Stopping suddenly can cause withdrawal symptoms, including anxiety, insomnia, and restlessness. Because of these factors, many geriatric specialists encourage cautious use of benzodiazepines in older adults. When sleep problems or anxiety arise, non-drug approaches may sometimes offer safer long-term solutions. Cognitive behavioral therapy for insomnia, for example, has been shown to improve sleep patterns without the side effects associated with sedative medications. Relaxation techniques, breathing exercises, and consistent sleep routines can also help restore healthier sleep habits over time. If someone is already taking benzodiazepines regularly, it is important not to stop abruptly. Instead, doctors often recommend a gradual reduction plan supervised by a healthcare professional. Another category of medication commonly used by older adults involves treatment for acid reflux and heartburn. Proton pump inhibitors, often called PPIs, include drugs such as omeprazole, pantoprazole, and esomeprazole. These medications reduce the amount of acid produced in the stomach, which can relieve the burning discomfort associated with reflux. For people experiencing severe heartburn or stomach ulcers, PPIs can provide remarkable relief. In the short term, they are extremely effective and often necessary. However, problems can arise when these medications are taken continuously for long periods without reevaluation. Stomach acid plays an important role in digestion and nutrient absorption. When acid levels remain suppressed for extended periods, the body may absorb certain minerals less efficiently. Calcium, magnesium, and iron absorption can be affected. Over time, deficiencies in these nutrients may contribute to weakened bones, muscle cramps, fatigue, or irregular heart rhythms. Low magnesium levels, in particular, can influence the electrical activity that keeps the heart beating in a steady rhythm. Long-term PPI use has also been associated with an increased risk of certain infections because stomach acid normally helps destroy harmful bacteria before they enter the digestive system. None of this means that PPIs are unsafe when used appropriately. In many cases, they are essential for treating serious stomach conditions. The key issue is duration and monitoring. If someone has been taking a PPI daily for many months or years, it may be worthwhile to discuss whether the medication is still necessary at the same dose. Some individuals can transition to lower doses or use the medication only when symptoms occur. Next, we come to a category that may sound surprising: medications prescribed to protect the heart itself. Blood pressure and heart medications save lives. They reduce strain on the heart, prevent strokes, and improve long-term cardiovascular health. Yet even beneficial medications can create challenges when the body changes with age. Diuretics, for instance, help remove excess fluid from the body, while this can reduce blood pressure and relieve symptoms of heart failure. Too much fluid loss can lead to dehydration or electrolyte imbalances. Low potassium or sodium levels can cause dizziness, weakness, or abnormal heart rhythms. Beta blockers slow the heart rate and reduce the force of contraction, helping the heart work more efficiently. But if the dose becomes too strong for an aging body, it may lead to fatigue, cold extremities, or reduced tolerance for physical activity. Calcium channel blockers relax blood vessels, lowering blood pressure, yet in some individuals they can cause swelling in the legs or ankles. These examples highlight why medication reviews are so important. A prescription written 10 or 15 years ago may still appear in a patient's medication list even though the body's needs have changed significantly since then. Finally, perhaps the most significant risk factor of all is something known as polypharmacy. Polypharmacy refers to the use of multiple medications at the same time, often defined as 5 or more daily drugs. Among adults over 65, this situation is extremely common. Each medication may have been prescribed with good intentions: one for blood pressure, one for cholesterol, another for sleep, another for pain, perhaps something for acid reflux or mood. Individually, each drug may serve a legitimate purpose, but when several medications interact within the body, the combined effects can become complicated. Side effects may overlap or amplify one another. One medication might cause dizziness, while another lowers blood pressure, creating a greater risk of falls. A third may affect kidney function, altering how the other drugs are processed. The result can be a cycle where new medications are added to treat symptoms that are actually caused by existing ones. Many older adults discover that after a thorough medication review with a doctor or pharmacist, some prescriptions can be safely reduced or discontinued. When unnecessary medications are removed, people often report feeling clearer, steadier, and more energetic. The lesson here is simple but powerful. More medication does not always mean better health. Sometimes the most effective step toward better well-being is reassessing what the body truly needs at this stage of life. Regular medication reviews, especially after age 60, are one of the best ways to ensure that treatments continue to support health rather than unintentionally undermine it. The heart has carried you through decades of living. Protecting it involves more than diet and exercise. It also means understanding the medications that influence how the body functions every day. Knowledge, communication with healthcare professionals, and thoughtful reassessment of long-standing prescriptions can make a profound difference. Because maintaining health in later life isn't just about adding years, it's about preserving strength, clarity, independence, and the ability to continue enjoying the life you've built.